The purpose of this lecture is to get an overview of the male reproductive system. Reproduction means to make more of, and in this case, our reproductive system is making more of our species. In the male, the reproductive system starts to be utilized when the boy reaches puberty. At this time, the hypothalamus in the brain begins to release GnRH, that should say hypothalamus instead of hypothalamu, but it releases GnRH, or gonadotropin-releasing hormone. This hormone travels to the anterior pituitary in the brain and triggers the secretion of LH and FSH. This is luteinizing hormone and follicle-stimulating hormone. Luteinizing hormone travels through the bloodstream to the Leydig cells in the testes, where it stimulates the secretion of testosterone. Follicle-stimulating hormone travels in the bloodstream to the Sertoli cells and spermatogonia. These cells and the Leydig cells are in the testes. The testosterone from the Leydig cells stimulates the Sertoli cells and the spermatogonia. And note the plus symbol there. The Sertoli cells are stimulated to nourish the developing sperm. The spermatogonia are stimulated to undergo meiosis to produce the sperm. And the process of sperm formation is called spermatogenesis. This hormonal flow is subject to negative feedback regulation. And negative feedback means that when sufficient levels of a product are formed, the product shuts off its own synthesis. The products in this case are sperm and testosterone. High levels of testosterone inhibit the anterior pituitary's production of LH and gonadotropin-releasing hormone from the hypothalamus, and high sperm formation also inhibit the production of hormones. Let's take a look at the anatomy of the male reproductive system. So in this picture, you're looking at a lateral or side view of the male. We are seeing a single testis, though the male has two testes, which hang outside the body where the temperature is a few degrees lower than body temperature. These lower temperatures are optimal for sperm production. The testes are in sacs called the scrotum. As sperm are being formed, they are stored and mature in the epididymis. Upon ejaculation, the sperm will flow through a tube called the vas deferens. The vas deferens runs up over the urinary bladder, and the sperm pass into the ejaculatory duct, which is not labeled in this picture, but is located at the junction of the vas deferens and the seminal vesicle. The seminal vesicle creates a fluid containing fructose, a sugar that is used as an energy source to transport the sperm once they're inside the female reproductive tract. The fluid from the seminal vesicles is also alkaline, which means it has a basic pH. This helps the sperm to survive once they're inside the very acidic conditions of the vagina. Also, the fluid from the seminal vesicles contains prostaglandins, and these prostaglandins, they're also going to help the sperm when they get into the female reproductive tract, because they lead to contractions of the uterine wall, which help to propel the sperm toward the egg for fertilization. But back inside the male reproductive system, the sperm are going to continue on their journey to the prostate gland, or through the prostate gland, which also secretes fluid. The prostate fluid contains citrate, which is another energy source for sperm, and the prostate fluid also contains enzymes which break up the clot of sperm and fluids once this clot has reached the female reproductive tract. The clotting of the sperm and fluids is supposed to help get the sperm into the female reproductive tract, but once it's there, it needs to be broken apart so the sperm can be on their way toward the egg. After the sperm pass out of the prostate, they pass by the bulbourethral glands, which are located at the base of the urethra. And the urethra is the tube that leads out through the penis. But the bulbourethral glands also secrete fluid. They secrete mucus, which helps to lubricate the urethra. And they also, the mucus is alkaline, which serves to neutralize any acid in the urethra, which might be created if there's any residual urine left there. Let's take a look at the testes and also talk about the sperm themselves. The testes contain seminiferous tubules where the sperm are formed in a process called spermatogenesis. The testis is attached to the epididymis, where the sperm are stored and mature, such as by gaining numerous mitochondria. Let's take a look at a single sperm. The sperm consists of the sperm head, and the head contains enzymes, and the nucleus, where the chromosomes are located. Remember that the sperm is haploid, and the nucleus will eventually merge with the nucleus of the female egg. And then there is the midpiece of the sperm where numerous mitochondria are made. 50 to 70 mitochondria are located there, which contribute to the synthesis of ATP for energy. And then there is the flagellum, or sperm tail, which does not become fully functional until the sperm reach the female reproductive tract. In fact, sperm are propelled out of the male body by during ejaculation by muscular contractions. And then the combination of the sperm and the fluids is called semen. So let's talk about how the semen gets to the female reproductive tract. And that leads us to erection and ejaculation. So erection occurs due to sexual arousal, and that is because of the sensory information that makes its way to the parasympathetic nervous system. This is your rest and digest side of the autonomic nervous system. Parasympathetic nerves stimulate vasodilation, or a widening of the arteries that lead to the penis, and this causes greater blood flow to the penis, which leads to erection. And then ejaculation occurs after a sufficient amount of tactile stimulation occurs. Tactile means touch. And this is the sensory information that triggers the sympathetic nervous system. This is your fight or flight side of the autonomic nervous system. Sympathetic nerves stimulate muscular contractions, which leads to the release of semen containing sperm, and also to orgasm. Let's talk about some of the issues that men face that you may have wondered about. You probably heard of vasectomy. This is a surgical procedure in which the surgeon cuts and seals off the vas deferens so that the male becomes sterile. Sperm are no longer released from the epididymis, and the male can still ejaculate normally, except that the fluid does not contain sperm. As well, men continue to make the same levels of testosterone. You think of it as sort of a permanent birth control, except that the vasectomy can be reversed if necessary. There are other issues men face beyond birth control. For example, prostate cancer is the most common cancer among men. It can be deadly, but on the other hand, in most cases, it has been found to be a very slow-growing cancer. And for this reason, it's usually young men that are treated. And there are various treatments available, such as cryoablation, which is a freezing of the prostate to kill cancer cells, or prostatectomy, which is a removal of the prostate, or radiation beads, which can be implanted into the prostate, and they give off radiation that kills the cancerous cells. But all of these procedures and surgeries have their risks, and often one or more of these treatments may be used in younger men. But in older men, a wait-and-see approach is often taken because those men are older and they might likely die of a disease other than prostate cancer. But fortunately, in the case of prostate cancer, there's an early blood test detection for what's called prostate-specific antigen, or PSA. And the prostate normally secretes PSA into the bloodstream, but higher than normal levels can indicate the presence of a prostate cancer. Erectile dysfunction is another issue that men face. This is a condition in which the male either cannot develop or sustain an erection. It is caused by issues affecting, or any issue that is affecting blood flow to the penis, such as stress, drug use, or conditions affecting the heart. Infertility is another issue, or low sperm count, which can have many causes, such as the possibility of family history of low sperm count, so genetics, drugs, or alcohol use can certainly affect sperm count. And then there's BPH, or benign prostatic hyperplasia, which is an abnormal growth of the prostate gland. Benign means that the growth is not malignant or not cancerous. But the condition can be serious because the urethra runs through the prostate gland. So men often report that they need to urinate, but not that much comes out. And so for years, surgeons would whittle away at the prostate to try to shrink the gland through surgery. But fortunately now, there are drugs that shrink the prostate. And that ends our lecture on the male reproductive system. Thank you for listening.